I'm Dr. Emily Wood. I'm a board-certified dermatologist here at Westlake Dermatology in Austin, Texas. Thank you so much for joining us. We have an exciting night planned to discuss all things Ellacor, our newest technology for skin tightening. Tonight we'll be going over what the procedure is, what it entails, who is right for the procedure, what the procedure is targeting. Then we'll kind of go over a small consultation and we'll review kind of what the procedure looks like. And lastly, we'll be doing a nice Q&A session where you can submit any questions you have to our question box online, and we'll gladly go over those with you. And then I encourage you to stay till the end because you might get a little surprise at the end that will benefit you to get a treatment. As I mentioned before, for the attendees who stick with us through the end of the session, we have a special surprise of $500 off a treatment with either myself or Sarah Bodie. Of course, you will be scheduled with a one-on-one consultation with either one of us, and the special is good through the end of October. So as long as you sign up for your consult and treatment before the end of October, you are locked into that special for Ellacor. So what is Ellacor? Ellacor, simply put, is micro-coring technology, meaning tiny cores of skin are taken out, but they're so small that the skin heals with no scars. So this is very unique. There is no other technology out there like it, which is why we brought it to Westlake Dermatology. We want to offer the latest and greatest for our patients. And Ellacor is primarily designed for skin tightening and improving wrinkles. Ellacor is unique because it does not use heat or thermal energy for skin tightening. Rather, it is taking out tiny cores of skin to heal with tighter, more youthful skin. So what is Ellacor designed to treat? Ellacor is designed for laxity and wrinkles of the lower face. So whether it be jowling or the fine wrinkling that occurs around the mouth that sometimes we refer to as smoker lines, Ellacor does beautifully for these conditions. Good candidate for Ellacor would be anyone with lower face laxity or jowling or possibly fine wrinkling around the mouth or perioral area. And what's great about Ellacor is that all skin types can be treated with this technology. So what to expect from Ellacor? So downtime, within a couple of days, you're actually able to cover up any redness with a tinted sunscreen. And then I would say most of my patients are comfortable being in a social environment within about a week. So it really doesn't have a lot of downtime, but it's a lot of bang for your buck.
Hi, I'm Sarah Bodie. I'm a nurse practitioner at Westlake Dermatology, and I will be demonstrating the Ellacor procedure today. My lovely model, Delynn, is a great candidate for Ellacor because she is specifically concerned about lower face laxity and fine lines. So Ellacor it can be used in other areas of the face and body off-label. It's the most effective in the lower face. So we'll be treating from cheekbone to jawline, from ear to ear, so the entire lower face. And Ellacor does allow for us to adjust treatment settings for more intense treatments, less intense treatments. So we can really focus on specific areas of concern. Delynn is a little bit more concerned with this region of the face. So we can give her a more intense treatment in that area for maximal skin tightening. So now we're going to mark the rest of her face, numb her, and get started on the treatment.
So much for attending. I really enjoyed tonight getting to talk about Ellacor, one of my favorite procedures. Everyone should check their text and email for links to book your consultation, and we can go over a one-on-one customized Ellacor consultation. Our giveaway winners will be notified via email or phone, so be sure to look out for that. You might be one of the lucky ones. All right, and if anyone has any burning questions, feel free to submit those in the Q&A box. We'll be sticking around a little bit longer to answer any questions you may have. Good evening. Thank you all for joining. What a fun night this is, and we're excited to answer some questions. I'm Dr. Emily Wood, and I'm a board-certified dermatologist here at Westlake Dermatology.
And I'm Sarah Bodie. I'm a nurse practitioner here at Westlake Dermatology.
All right, so let's see. I think I've seen a lot of recurring questions about is it painful? That's a great question. So I would just say when you come in for your pre-op, we will go over a customized plan to control your pain. So it really makes the procedure very comfortable. Sarah, you've actually had the procedure done, so I think you could speak to this a bit.
Sure, yes. So I think all of our patients will get some local anesthesia, some injections. They're a little bit uncomfortable, but really we have nice injection techniques to make it very gentle. After that, you are completely numb. So for the treatment itself, there should be minimal to no pain. If there's any little hot spot here or there, we can always add some additional numbing if needed. So a few numbing injections, and then the treatment itself is painless to very minimal discomfort.
Mm-hmm. Yeah, another really good question that I saw popping up was, what is the difference between microneedling and Ellacor? So I think that's a good point. So microneedling is basically creating tiny little holes in the skin, whereas Ellacor is actually taking out small little cores of skin. So you're actually taking out some of the tissue that's creating laxity, and it's healing tighter together so that you have less loose skin, less fine wrinkles.
Okay, there's a good question. Do you need more than one treatment? So we are recommending really anywhere between 1 and 3 treatments, and it really depends on the patient and your goals. So certainly everyone would get improvement with just one treatment, but you could continue your treatments and you can space them as soon as every month, or you can kind of push them out further. It doesn't have to be 1 month apart, but no sooner than that.
Mm-hmm. And then just to remind everyone, you attended our session tonight, so you're eligible for $500 off the treatment. So that's really great special. I would take advantage of. You can lock that in if you schedule your pre-op by the end of October. So basically, if you're like, man, I watched this webinar, I want to do it, you don't have to schedule another consultation. This was basically your consultation. So we'll just go ahead and schedule you for a pre-op visit, either with myself or Sarah. Let's see. Another good question I have seen pop up a few times is, like, does it replace Botox? So I would just think of these as kind of two separate procedures. Botox is more for dynamic movement wrinkles. This is more for skin laxity, for jowling, which is just like the little pockets of skin that form here, from the etched in lines around the mouth that occur, just over time from speaking or drinking out of straws or smoking. So they're kind of very separate. Of course, if you have more questions about what the differences are, we can always, go over that in your pre-op visit.
I saw another great question. Are the results permanent? And yes, they are permanent because there is a kind of a good percentage of tissue that's truly removed will continue to age. So while the results are permanent, that doesn't mean you won't want to continue maintenance treatments over time.
Let's see. Kind of some questions I've seen pop up about, expected sort of side effects. So most commonly patients are a little bit red. You might have some mild bruising. I would say most of my patients are comfortable within, a couple of days with being in public or social, interactions with other people. The nice part about Ellacor is that you can start wearing a mineral tinted sunscreen, which we would recommend for you within a couple of days of the treatment. Is that kind of what you're
That's what
seeing
I'm
too?
seeing as well. Yeah, so redness may last a week or two, but pretty easy to cover after 3 days with a tinted sunscreen. And then makeup, I'm recommending waiting a week. What are you saying with makeup?
I'm okay with mineral tinted sunscreen, which I can show you which ones are okay within a couple days, but like real makeup, I would say the same, like a week. Yeah. Let's see.
And other, I think, downtime to expect would just be maybe a few days of really minimal bruising. I'm sorry, bruising or a little bit of swelling as well, but no pain, luckily.
Yeah, and then, if you are someone who's in the public eye a bit, or you have a job that's very lots of social interaction, there are some other lasers that we can add to the treatment that will sort of speed up your healing time. So those are optional, but we do have that available just to, help you get back into your routine so that you aren't limited with work or events. Here's a good point. Where are we offering this treatment? This treatment is very new. So we are actually one of the only providers in Texas to offer this, and which is very exciting. So it's at Westlake location. So Sarah and I are both here. I also see patients in Marble Falls, so we could always do a pre-op there if that's more convenient, but the procedure will be here in Westlake.
Can you do it around the mouth? Yes, you can. So it is indicated for the full lower face, so around the mouth, and then ear to ear, kind of from cheek to jawline. And so it's great for the laxity we get in the lower face, the jowls, and then lines around the mouth, or even we start to get a little bit of increased kind of distance between our nose and our upper lip as we age. And treating the upper lip can actually give a little bit of a subtle lip lift. Will not make your lips look larger. It's very minimal, but that's really nice as we age to have now an option to help improve that without surgery.
Yeah, I actually think it's a great option. I have so many patients wanting to address those like smokers lines around the mouth, and they're like, Dr. Wood, I've never smoked a day in my life, and I have these horrible lines. And I think that Ellacor is really one of the best treatments for those that provides long-lasting results. I've seen a couple of questions about age as far as who would be eligible for the treatment. I think that really, if you have any mild laxity, if you have fine lines, wrinkles, really doesn't matter what age you are. I think you would probably be a good candidate for the treatment.
And we did want to just clarify that if you have additional questions and you'd like a consult, we are still happy to see you for a consult, or you can schedule with one of our consultants. should you discontinue retinol before the procedure? I'm recommending stopping just a few days before the procedure, and most patients can restart 1 week after.
Yeah.
Me too.
I'm pretty much doing the same. Yeah. Basically, with retinol, you just don't want your skin to be red and peely before the procedure, which some people experience that with retinols. And of course, for your pre-op visit, we'll go over all those exact details, and even in a printed form, so you're ready for your procedure. Again, ballpark price. So the cost of the procedure normally $3,200, but with this current special, because you watched our lovely webinar, you will get $500 off if you schedule your pre-op before the end of October. Yeah, working out afterwards. So I would say maybe the day of the procedure, you probably don't want to work out, but I'm okay with, light to moderate exercise as soon as like 2 days after. So it really doesn't limit your workout routine. Do you say the same, Sarah?
Yeah. Mm-hmm. Yeah. And to clarify, yes, it is the Bee Cave location, the Westlake Dermatology on Bee Caves Road.
Let's see. We had a question about whether it can help with nasolabial folds, and yes, it does address that because you are taking out small little cores of tissue in that area, so that will heal tighter together. I also saw another question about whether it can be combined with fillers. So yes, some patients are doing this first, and then we might customize your treatment and add fillers down the road.
How long does the procedure take? So the numbing portion of the procedure usually takes about 10 to 20 minutes, and then the kind of coring, the Ellacor procedure, another probably 30 to 40 minutes.
Mm-hmm.
There are certain types of anesthesia like laughing gas that some people offer that would have you stick around after for about 15 minutes if you used that. And so kind of check in to check out, photos, washing your face, all of those steps, probably just plan for a couple of hours.
Mm-hmm. Mm-hmm. Yeah.
And you can drive yourself home.
Yeah. Yeah. And really my experience is that while we're doing the treatment, me and the patient are just chatting. They're very comfortable. It was really a painless experience for them. So, yeah, just that early on, the numbing is probably the part that's a little bit spicy. But beyond that, it's a really nice experience. Question about, why would you choose this over, say, a facelift? I think one thing to know about facelifts is even facelifts aren't permanent. So that may have to be redone down the road. If you've had a facelift before and you're looking for tightening, I would say that does not exclude you from having it done. So some patients may still be interested in that.
I think it's recommended to wait at least a year after a facial surgery, like a facelift, before having Ellacor. Does it improve small scars? It can, while it might not be the very best treatment for scars. There may be other things that treat that a little bit better. Yes, we do see improvement in texture and scars with the treatment.
Yes. This a question, can you get Botox in the lower face if you get the procedure? Yes, you can. I wouldn't do it on the same day. I would probably say probably 3 to 4 weeks after you could do Botox.
Would this lift a double chin or tighten that area? So, when we are treating areas other than the lower face, it's considered off-label. So, not as much, patient reports on that, not clinical studies on that. I think we're both kind of inching down a little bit, treating right under here. Kind of think of it more as a little skin tightening, not quite as skin tightening as we would get on the lower face, but.
And I think also that would be where, you come in, have your pre-op or consultation, and we can kind of speak to your personal anatomy and what would be right for you. So that could be something we could discuss more in depth individually.
How does this compare with the Genius? That's a great question. So Genius, which is microneedling, they both just use little needles to create holes in the skin, where Ellacor creates holes with hollow needles, and the skin is actually suctioned and removed. So there's true skin removal versus just collagen synthesis that we would expect with Genius or microneedling.
Another question, how many treatments do you typically recommend? So most patients do between 1 and 3 treatments. If you do just 1, you're going to see nice results, but sometimes we can build upon that, and that's when patients are interested in doing, subsequent treatments. Yeah, pain control options. There are actually several options that we can customize for you depending on your pain tolerance. So if you need, oral pain medications, happy to provide that for you. There's the laughing gas, which a lot of people do really well with. So yeah, there's a lot of good options to keep you comfortable for the procedure.
Yeah, topical numbing cream can help with those initial injections as well. But if you've had the Genius or Ultherapy, I would say this is less painful than either of those. We're able to numb you a lot more effectively for this treatment.
Here's a good one. What is the difference between a pre-op and a consultation? So if you watched our webinar tonight and you are like, I want to do the procedure, I'm ready to schedule my date, then we would schedule you for a pre-op. And so a pre-op is where we go over your medical history. We also go over, a few supplies that you would need to get beforehand just for aftercare. We go over your pain control plan. So that would be your pre-op. And then if you wanted to just do a consultation, we would just, have you come in. We can chat a little bit more about Ellacor and how it applies to you and what your questions might be.
And there was a question about clarifying the cost. So the $3,200 is for a single treatment, and then the $500 off, of course, for tonight.
Here's a good question. If you've had filler around the lip or mouth area, can you have Ellacor? You can. So, if you're taking out tiny cores of skin, so it's really, I haven't seen any problems with patients who've had filler. All the patients I've treated have had fillers before.
Yeah, I've had fillers.
Yeah.
No issue.
Yeah, she looks great.
Things to promote healing. Okay, yes. So a lot of this will be covered at your pre-op. We will have you, or we will recommend you avoid things that might increase your risk of bleeding or bruising. So just avoiding blood thinners before. There are some good skincare products we'll have you start after that you could even start a few days before just to prep the skin.
Are you doing nectar?
Yes.
Yeah.
Yes.
Yeah, I like the nectar. So there's a nice product by Elastin, and it's called Nectar. So it's been shown in multiple studies to speed up wound healing. So that can be a nice addition to your treatment. Not necessary, but we do have patients who are interested in doing, everything they can to optimize healing time.
Do you recommend arnica or bromelain for your patients?
I have not made it a standard practice for Ellacor, but I think it certainly wouldn't be a bad idea.
Same. I haven't recommended it, but if
Yeah.
someone wanted to kind of do everything they could to speed up the recovery, starting with some homeopathic supplements of arnica and bromelain decrease swelling and bruising risk. And there's not a lot of bruising expected from Ellacor, and the bruising is actually not from the Ellacor itself. It's just if you get a bruise from the numbing injections that we'll see a bruise sometimes.
Yeah, that's a good point. And then also for my patients, I sometimes offer you like a V-beam laser if you have any significant bruising. So V-beam's another laser that pretty much erases bruises very quickly. So again, there's lots of measures you can take to kind of minimize redness, swelling, bruising. How does it compare to Fraxel? So that's a good question. So Fraxel is going to be treating more skin surface, tone, texture, fine lines, wrinkles. Ellacor, it's going to be, you know, taking out those tiny little cores of skin like you saw in the video and producing tighter skin. So I feel like in my eyes, Ellacor produces a lot more tightening than Fraxel would be. Now, I do have some patients where we're combining the two, where they do Ellacor first, and then about a month later, we do a Fraxel on top. And it's totally not necessary, but I've seen it produce some really nice results because you're getting the tightening and then you're getting the really nice improvement of the skin surface. So sometimes we like to layer things.
How does it compare to Sculptra? So Sculptra is not a filler, but an injectable that stimulates collagen, where Ellacor truly is removing tissue. So that would be another great combination, but definitely a different type of procedure. Sculptra is relying on your body to create collagen, where Ellacor is just removing that excess skin entirely in a physical way.
A question about if you live out of town as far as follow-ups. My team, and I'm sure your team too, Sarah, we're really good about coordinating things for out-of-town patients. So I don't necessarily have to see you the day after in person. We can always kind of work things out to where we do some post-op check-ins like over the phone and through pictures. So I understand totally if it's a bit of a far drive for you to come back.
I agree. Phone follow-up, photos, could definitely do that. Does it treat smile lines? This is a great option for those smile lines that feel like previously they were challenging. We didn't have a whole lot to offer for these tiny little fine lines here that it's just not the type of line we would put a filler in. Ellacor is great for those.
And also really not the type of line that you can really address with Botox either. It's really nice to have something that you can target those lines with.
Does it help remove the aging orange peel effect on the lower face? Yes, it does. So that could be either just due to sun exposure over time. And yes, Ellacor is a good option for improving that.
Question, is it suitable for men? Yeah, anyone can do Ellacor. Men, women, really any age. So, and I think also a good point is that it can be used on even darker skin types. So that's not always the case with certain devices. So it really is a good treatment for multiple people.
Men would need to shave their beard prior to the treatment, though, for best results. What is the additional cost of additional anesthesia?
It would depend. You know, if we're doing, like, sometimes I give patients oral pain medications, that's no additional cost other than you just picking up the medication beforehand at the pharmacy. The laughing gas has a small cost associated with it. Other things, if you really have a lower pain tolerance and we need to do something a bit stronger, it just might have a small operating room fee associated with it.
And there's no charge for the injectable lidocaine or the topical lidocaine. Getting a lot of questions about treatment in other areas. I'm really staying on label for now, so just lower face for me.
Yeah, I would say kind of the same for me. Now, there are lots of clinical studies being done for Ellacor, so I would say that, in the near future, it will be approved for other areas, and we can always talk about those areas in your consultation, if you have questions, whether or not that might be right for you.
Can you provide recovery photos? Yes, we can definitely provide those for you. I show those to my patients at pre-op.
Yeah. These were some good questions, Sarah. This was fun. Yeah. So I think we've kind of answered a good amount of questions. Of course, if we didn't get to your question, feel free to set up a consultation with one of us. If you're ready to schedule your procedure, you can schedule a pre-op visit. And just to remind everyone, the special is $500 off the $3,200 procedure, and you can lock that in if you schedule your pre-op by the end of October. And then you want to talk about our giveaway?
Our Botox, yes. We have a raffle for a lucky participant tonight who will get $50 units of Botox for free. So check your emails and your texts to see if you are the winner for that.
Excellent. Okay. Yeah. Thank you all for tuning in.
We look forward to meeting you.
Yeah. Have a great night. Bye.